So when it comes to using skincare products to address mask acne, two things need to be addressed. First of all, strengthening the skin barrier to help to downplay the effects of friction, and also Airin will be sharing how makeup can play a role in strengthening the skin barrier or to sort of add to the defenses of preventing mask acne. And the second part to mask acne with skincare products is about reducing inflammation. So a couple of skincare ingredients I have brought along to share with you guys are niacinamide, azelaic acid, as well as ceramide. So
all my favorite ingredients.
Mine too. So niacinamide is a skincare ingredient that I'm a big fan of, and my favorite product is from The Ordinary, a very affordable skincare brand from Canada. What it does, niacinamide, is basically it reduces oiliness on the skin. Number two, it reduces inflammation, and number three, it reduces blemishes. What's great about it is that it's suitable for people with sensitive skin because it helps to reduce inflammation. It's also pregnancy safe, so if you're expecting or breastfeeding, niacinamide is a good product to add to your skincare routine. The one I'm using personally is from The Ordinary, and it's 10%, but actually, if you want to get niacinamide, you can choose something that's about 5%. That's where the studies show that 4 to 5% of niacinamide is pretty good for anti-acne effects. When it comes to 10%, we're not entirely sure whether it's really necessary, but no harm. I think that it's something that worked for me and I would recommend to you.
So for niacinamide itself, right, what if like there are products out there that actually inside, like when we look at the ingredient list, there's niacinamide, does it work for us too?
It does, but the issue with these products that aren't very clear or upfront about the concentration is that we don't know whether it's effective enough. The studies, like I said, mentioned about 4 to 5% of niacinamide, which is actually fairly high. So if you find it at the bottom of your skincare list, probably under 0.1%, so no harm, but don't expect too much.
So for niacinamide, will it react with any ingredients in our skincare routine?
So it's a fairly safe ingredient, quite easy to use, very pH friendly. But it also means that if you're going to use products that are pH sensitive, for example, vitamin C, ascorbic acid, where the ideal pH is actually around 3 to 4, then you might have problems with niacinamide because it then reduces the efficacy of this particular ingredient. But otherwise, I find that it pairs very well with stuff like retinoids, which are a mainstay in treating acne. What retinoids do is they sort of dry the skin up a little bit, sort of increase cell turnover, move along the cell clearing pathway so that pores get unclogged. But a lot of people experience irritation with using retinoids, and your skin needs to get adapted to it. So one of the things that you can use to reduce your process of retinization is actually niacinamide.
Initially when I used retinoid, I had the same worry and problem. It was really dry and it was flaky. So I was very worried, oh no, is this like a reaction or something? But I mean, Dr. Rachel always told me, oh no, you have to pace it out, you will see results after a while. So after using it, I saw effective result. Like my skin really got a lot better as compared to the first time she saw me. It was bumpy and a little bit red.
It takes about at least 4 to 6 weeks for you to see results, so you need a lot of patience. It isn't magic. People with sensitive skin or even normal skin get what we call retinol dermatitis, and I'm a victim of it too. So I went to work one day with like this retinol burns on my face because I was trying to be too garang. I thought, okay, I should try and see whether it works. And once I got through that phase, and it took me about 1 year to actually move up to prescription strength retinoids, almost on the daily.
1 year.
It took me 1 year, because I have sensitive skin. And I now can use prescription strength. So even like the milder ones these days, I kind of not very impressed. I may be a bit biased because I'm now on the prescription strength ones.
So you won't really see result within a week. Anything that's like within a week may not be a
It's called makeup.
That's makeup. That's
makeup.
Makeup is like instantly transformed.
Instant gratification.
Whereas for like skincare, you really have to commit yourself to it to really see like how effective it is on your skin. It's good. So what other products can you share?
This one I might be a little bit biased, but azelaic acid. So azelaic acid is another like all-round ingredient. It's anti-inflammatory, anti-pigment, anti-blemish, anti-acne. Very useful ingredient. So very useful for people who have mask acne but have sensitive skin and they're not reacting very well with maybe the benzoyl peroxide or the retinoids. If you're looking for azelaic acid, try to look for something around 15 to 20%. Is what the studies show. You need something above that concentration. I might be biased, but I use something like 20% that's prescription strength. I tried 10% honestly with for about 4 weeks, and it just didn't seem to
Actually, I tried the 10% lah. I will have to say that the 10% kind of take a longer period of time to see result, but it's definitely, I feel azelaic acid is definitely on the safe side
It's
of
safe.
things.
So I, for example, when I get mask acne sometimes and my skin is just very irritated, I actually use like a huge like here, like almost like a moisturizer.
So it does not actually irritate.
It doesn't irritate. When I first put it on, there's a bit of tingling sensation, but
Yeah.
bear in mind I'm using 20%. You see.
Oh yeah.
So like then 30 seconds later, it seems to be okay. I find it's something that works at least sometimes when I get the irritation and mask acne.
Yeah, and I realized that azelaic acid is not as dry as benzoyl peroxide. That's what I like.
Yeah. But benzoyl peroxide is a little bit different. It's antibacterial.
Yeah.
So it sort of
Kills the
kills the
germs.
bacteria, that cause acne. Whereas azelaic acid doesn't really do that. It addresses the inflammatory part of it. So they work differently. They're not mutually exclusive.
Okay.
That's why for people who've got a lot of inflammation from mask acne, just inflammation from skin irritation, rosacea, sensitive skin, whatever, azelaic acid is not bad.
Okay.
And then the other ingredient that I really love for acne, but I didn't bring it along today because it's such a huge tub actually, is ceramides.
Oh,
So I use
ceramides.
the one from CeraVe, it's like one big tub.
CeraVe.
It's like 300 grams.
Yeah.
So what ceramides do is basically they strengthen the skin barrier. Ceramides are an essential component of our skin, and it's something that we lose as we get older. That's when the skin thins out, becomes more sensitive. And people with skin issues like maybe psoriasis or eczema, they don't have enough ceramides in the skin, so there's a lot of hypersensitivity.
Yeah.
So by building up your ceramide level in your skin with
It's like building blocks, like bricks.
literally
Yeah.
a brick and mortar
Yeah.
component of the skin.
Yeah.
You sort of fortify the skin's defenses
Yeah.
against irritation, abrasion, and mask acne. So if you're someone with acne, you might want to look for something with a consistency that isn't so creamy.
Yes.
Because
Yeah.
it may clog up your pores.
Yeah, so the previous one that I used was from Elizabeth Arden. So it's like the capsule
Oh,
form.
the ceramide capsules.
Yes.
So cute.
So it's very liquidy. So it's not like a heavy cream form. So that one is actually really good.
I actually heard
for
very good
sensitive
things
skin.
about it.
That's definitely their hands down their best seller. So that's something I use when I feel like my skin's very irritated. That's the moisturizer I use. Yeah. And for myself, actually, before I went to you, right, I actually used a lot of soothing products like Centella Asiatica,
Sika.
which
right?
is Sika,
Very
yeah,
cold.
Sika. I feel like that's one thing that I think most of our product has, and Blue Tansy.
The blue can see about
Yes.
It's quite newish actually.
Yeah, so that itself is like definitely an anti-inflammatory ingredient. So I really like that.
Mhm.
It's a very calming gel cream that actually is high in Centella Asiatica, which is Sika. And I also like this Heart Leaf Ampule from Ecom. So it's actually a tightening.
From Korea.
Yeah, so it's actually by this Hortunia hodata or something like that. So it's actually a plant that is very anti-inflammatory and calming for the skin. And also, I think masking your face is quite important. So I'll use this tea tree purifying mask.
Okay.
Yeah, this is the ingredient that I was talking about, Hortunia cordata.
Sounds very exotic.
Yeah, so it's actually a kind of like plant extract that is soothing and it helps with healing.
Mm-hmm.
Yeah, so for example, like I think it's a Korean plant extract, I would say. So what they do is that like if they have a cut and stuff, they actually apply that for it to heal.
Actually, that sounds like Sika.
It's like Sika, yeah. So I think it's like a sister of Sika for sure.
Still Sika.
Yeah, so I think this is a great product to really soothe your skin. I think a lot about mask acne is that, and a lot about all these breakouts really because your skin is inflamed.
Inflamed, so you need to reduce inflammation,
Yeah, so
sort of
this-
calm it down, reset it.
Yeah, so these are things that you can do at home. For example, if our skin is actually irritated, right, can we actually use like AHA, like glycolic acid?
Not a good idea.
Not a good
Because
idea.
when your skin is irritated, probably there's some issue going on with the skin barrier, there's some
Right.
inflammation going on.
Yeah.
When you use things like acids, regardless of what kind of acids, you're kind of exfoliating the top layer of the skin.
Yeah.
And it may exacerbate any irritation or hypersensitivity that may be present. So maybe wait for that acute episode to settle. Maybe give it a couple more weeks, to be really certain that inflammation is settled before you jump into using acids, because you don't want your skin to be getting any more red, more
So
painful.
BHA, PHA, we should also.
I think not great. Even PHA also, it's supposed to be a less intense acid, but
Yeah.
still because of the process of exfoliation, you're taking away the top layer of the skin, and when your defenses of your skin aren't strong enough, it's not a good idea to remove it.
Yes, yeah. And also I think a lot of us has been talking about hyaluronic acid.
Hyaluronic acid, that's
Does
right.
it actually help with the current situation like mask acne?
So it doesn't actually sort of address the pathways in mask acne, but it's a very powerful humectant or a moisturizer that draws water into the skin. So when the skin is very dry, because when the skin barrier is disrupted, there's a lot of water loss. We call it transepidermal water loss.
Yeah.
That's why people with conditions like eczema, you can see that the skin very dry. There's a lot of premature skin aging going on. So you also need products that sort of bind to water molecules to keep the skin moisturized and to prevent these effects. So hyaluronic acid is one of those that's very affordable, effective, and very safe, and generally very pH friendly.
Yeah,
so my pro tip for you if you're looking for hyaluronic acid is to probably look for products that contain a mixture of hyaluronic acid molecules. Now, why is this important? Is because traditional hyaluronic acid molecules are very big and they sort of sit on the top layer of the skin called the epidermis. But when you have smaller ones, and you can look for products that say you've got low molecular weight hyaluronic acid or super low molecular weight,
or nano size,
and basically they're just chopped up into smaller hyaluronic acid molecules, and they can sort of sink deeper into the skin, still in the epidermis because they can't cross the dermis. They're too big still, no matter how small they are. But when they can sink into different layers of the epidermis, there's more water retaining properties. So that's why I tend to look for things that contain a mixture rather than just one size.
Actually, one very, very good hyaluronic acid that I use and I was amazed is by Decote. The liposome hyaluronic acid serum. So basically, even when I touch it, right, it's so silky and so supple. Like when you apply it, it feels like it's being absorbed into your skin. It doesn't feel sticky or heavy on your skin. So that's one product I recommend. Of course, the price point is slightly on a higher end, but because they break down the molecules to nanoparticles, so it kind of like get absorbed to the epidermis. What are the solutions for example, like for me, I have like acne scar from mask acne, right? So Dr. Rachel actually recommended me a series of things to do. What would you recommend?
So post-acne marks that are dark, they're called post-inflammatory hyperpigmentation. And essentially, because of the inflammation, the skin reacts by producing pigmentation. And you can think of these dark marks as just treating pigmentation. So when it comes to skincare products, number one, prevention. Okay, so even if you've got acne, please wear sunscreen. We want to prevent these new marks from getting darker when they form, when your acne sort of clears and is moving to the pigmentation forming phase. Number two, you can look for pigmentation lightening products. So my favorite is retinoids because it's tried and tested. Also helps to unclog the pores. So very 2-in-1. But you've got other stuff like even niacinamide, topical vitamin C. They're not bad. When it comes to, I guess, when you get something really bang for your buck, then you can consider more heavy-duty treatments. And so what I do in my clinic for Airin, and even for myself and most of my patients with acne, actually is a combination of chemical peels as well as Q-switch laser. So what chemical peels is they really exfoliate the skin. So they take off the top layer of the skin. And the nice thing about these acne marks or post-inflammatory hyperpigmentation is that they're fairly superficial.
So for example, if like we want to use like chemical peels like glycolic and stuff at home, do you think we can still use like maybe once a week?
I think there's no harm. So the studies that show chemical peels work show that we need a concentration of about 20% and above. But let's be honest, you're not going to be able to get it over the counter. The ones you see under 5%. So I'll say they maybe have a little bit of effect. Maybe if you use them consistently, no harm. Like you cannot compare it to a chemical peel because the ones I do actually are like sometimes 35%, 40%.
Yeah, it's definitely.
They're like 1 minute and then we're done. Whereas the ones that you get over the counter probably much lower concentration. And even brands like Drunk Elephant that claim that they have 25% AHA, right? They're not really very upfront of the ingredients. Is it truly 25% AHA or 5% of mandelic, 5% of glycolic plus, and therefore 25% you see? So that's what I find as an issue of transparency when it comes to labeling.
Right. That's something that we can take note of and what a clinic can offer that we can't find on the market.
But let's be honest also, during circuit breaker, most of us have access to see our doctor. So even right now, I guess it's not entirely convenient to see our doctor. There's really no harm, using acids under 10% to see if it works. But if it does, then it's really great. You found something affordable. But if not, then you need something a little bit more heavy duty.